Hello, so my name is Xavier Ramirez, and today I'm going to be walking through my presentation talking about determinants of health and how they are measured. So, initially on my first slide, I talk about social determinants of health and their influence on health outcomes. So, this slide focuses on social determinants, but how they overall affect the health outcomes of people in society. So, social determinants of health are the conditions in which people are either born in, they grow up in, or they live or work, and also the age, and that all these factors play a major role in shaping the health and well-being. Then I move on to talking about economic stability, how it is one of the most important factors. This includes having a stable income, steady employment, safe housing, and reliable access to food. When people lack these basic needs, they are more likely to experience stress and poor health outcomes, and they may delay seeking medical care. Education is another key determinant, which is being able to read, understand health information, and start school at a younger age, or even graduate from high school and pursue a higher education level to live a better overall health. Education improves health literacy, which helps individuals make informed health decisions and recognize symptoms earlier. Community and social context also strongly influence our health. This includes social engagement, discrimination, incarnation, and the level of social support a person has. Individuals with lower income and education levels at a higher risk of cardiac or chronic disease, such as diabetes and cardiovascular disease. Additionally, a lack of education and health knowledge can delay the diagnosis and treatment of health conditions, leading to worse outcomes later on. Finally, discrimination and weak social support systems can increase mental health challenges, including stress, anxiety, and depression, which further affects both the physical and mental health. Overall, addressing social determinants of health is essential in reducing the health disparities and improving health population. On this next slide, I move on to identifying morality based on health status. So this slide actually focuses on different types of morality rates, and which helps us understand this overall health of a population and identify areas where health systems actually need more improvement. So the first is the crude deaths, right? So this rate refers to the total number of deaths per 1,000 people in a population each year. This gives us a general picture of how healthy a population is overall, but it does not account for the age or specific causes of death. Next, I move on talking about infant mortality rates, which measures the number of deaths among infants in under 1 year of age per 100,000 live births. So this is a key indicator of maternal and child health outcomes because it reflects access to prenatal care, quality of medical service during birth, and also infant care after delivery. Then the next one is under five mortality rates, looks at the number of deaths of children under the age of 5 per 1,000 live births. This rate helps us understand the quality of child health care, nutrition, and access to clean water and vaccinations. Lastly, maternal mortality rates measures the number of maternal deaths per 1,000 live births. So this indicator shows how safe pregnancy and childbirth actually are and reflects access to prenatal care, skilled birth attendants, and emergency services. Together, these moralities measures how public health professionals identify health disparities while also evaluating how well healthcare systems are supporting different populations. This next slide explains several key measures used in public health to understand disease patterns and the healthcare impact. So, incident rates shows the risk of developing a disease by measuring how many new cases occur over a certain period of time. It helps us identify whether a disease is increasing or spreading in a population. Next is prevalence rate, which looks at the total number of existing cases for both new and ongoing. This helps us understand how widespread a condition is and how much burden it places on the healthcare system. Next is attack rate, which is used during outbreaks. It measures how many people become sick after being exposed to a specific illness, which helps public health officials track how contagious the disease is. Next is disability, which refers to the years of life lost or lived with illness or impairment. This measure shows how disease affects the quality of life, not just death rates. Finally, the hospital admission rate indicates how severe a disease is and whether people have access to healthcare. Higher admissions rates may reflect more serious illness or barriers to preventative care. Together, these measures help public health professionals assess the risk, plan interventions, and allocate healthcare resources effectively. This slide focuses on the importance of health equity and how it connects to a Christian perspective. Health equity is important because it helps reduce unfair differences in health that are often caused by factors like income, education, or social status. Everyone should have a fair opportunity to be as healthy as possible, regardless of their background. When we promote health equity, we are ensuring that people have access to healthcare services no matter their social class. This leads to better overall health outcomes, fewer preventative issues or illnesses, and stronger communities. Health equity also helps build justice with the public health system by addressing barriers that keep certain groups from receiving proper care. From a Christian perspective, health equity aligns closely with biblical values. In Matthew 25:35-40, Jesus calls us to care for those who are sick, poor, and vulnerable. This scripture emphasizes compassion, mercy, and loving our neighbors through action. Striving for health equity reflects Christian values of justice and respect for every person, recognizing that all individuals are created in the image of God. By supporting fair access to healthcare, we are living out our faith by promoting dignity, fairness, and care for all. This slide explains about mortality and morbidity indicators which reveal about the health status of the United States. First, life expectancy in the US is slightly lower than compared to many other developed nations. This is largely influenced by chronic diseases, lifestyle factors, and social determinants of health, such as income, education, and access to healthcare. Historically, infectious diseases play a major role in mortality. For example, before vaccines were available, diseases like smallpox, measles caused massive death rates. According to the NIH, up to half of the population could die during smallpox epidemics, and measles was nearly as lethal in vulnerable populations. This highlights the importance of public health interventions like vaccinations. Infant mortality rates in the US have been declining over time, which shows the improvement in healthcare and medical technology. However, in the US, it still has a higher infant mortality rates compared to other peer countries. This is closely linked to disparities in maternal health, access to prenatal care, and inequalities. Lastly, chronic diseases such as cancer, heart disease, and obesity remain the leading causes of death and disability in the United States. These conditions contribute significantly to a long-term illness, reduce the quality of life, and a higher healthcare costs. So, emphasizing the need for prevention and early intervention are truly important.
Governmental organizations play a major role in protecting public health. They fund public health programs such as disease prevention, maternal and child health, and community clinics. They also set and enforce health standards, which ensures hospitals, food producers, and workplaces operate safely. During outbreaks and emergencies, government agencies coordinate responses, track disease spread, and share public health guidance. In addition, they ensure access to clean drinking water, safe food, and vaccines, which are all essential for preventing diseases and improving overall population health. On the other hand, non governmental organizations help fill gaps where government services may be limited. Many rely on volunteers to provide care in underserved or hard to reach communities. They often play a crucial role in emergencies and disaster response, such as providing medical care, food, and shelter. Non governmental organizations also focus heavily on health education, helping people understand disease prevention, healthy behaviors, and how to access healthcare services. Together, governmental and non governmental organizations work closely to improve access to care, prevent disease, and promote healthier communities. In ancient times, public health efforts focused on controlling the spread of disease. During major epidemics like the plague, early quarantine practices were introduced. Although people didn't fully understand germs at the time, they recognized that separating the sick could reduce transmission. During the Middle Ages, public health measures expanded to include isolating sick individuals and improving sanitation. There were more attention to controlling waste in water systems since poor sanitation was linked to the spread of infectious disease. In the 19th century, major environmental changes greatly improved health outcomes. Communities began providing clean drinking water and implementing proper waste and removal systems. These changes significantly reduced the deaths from diseases. In the 20th century marked a major turning point with the development and widespread of use of vaccines. Vaccination programs helped control and even eliminate certain infectious diseases, including smallpox and greatly reduced illnesses like measles. In the 21st century, public health focuses on the disease prevention and chronic disease management. An example is the tobacco control, which helps lower rates of cancer and lung disease. According to the National Institution of Health, worldwide tobacco use killed nearly 5 million people annually, which highlighted the importance of prevention and focused on the public health strategies. And I know I just talked about this timeline in the last slide, but I've also provided another in-depth timeline explaining how it started from the ancient times to the Middle Ages to the 19th century, leading to the 20th century and then into the 21st century. One of the most crucial aspects in the nation's health history occurred in the 20th century. This period saw a major advancement that drastically reduced disease and improved life expectancy. In the 1950s, vaccine played a crucial role in decreasing the spread of serious infectious diseases such as polio, smallpox, and measles. Scientific breakthroughs made this possible. According to the National Institution of Health, the ability to grow viruses in tissue culture for extended periods led to the development of vaccines against measles in the 1950s. These vaccines helped protect millions of people and was a way to prevent widespread disability and deaths. Vaccine development overall was one of the most important, impactful public health achievements in the 20th century. Vaccines for diseases like measles and polio saved millions of lives, reduced hospitalizations, and helped eliminate or nearly eliminate some diseases in many countries. Another major public health milestone was tobacco control. As research began to clearly link smoking to serious health conditions, public health efforts focused on educating the public about smoking risk and regulating tobacco advertising. These actions helped reduce smoking rates and lowered the risk of disease such as lung cancer and heart disease. Together, vaccines and tobacco control highlights how prevention based in public health efforts can improve significantly and improve population's health. One major issue public health faces today is vaccine hesitation. Vaccine hesitation is a challenge for public health practitioners because it involves the delay in accepting or the refusal of vaccines, even when the vaccines are available. This hesitancy makes it harder to protect the communities, especially vulnerable populations such as children, older adults, and individuals with weakened immune systems. Because of this, public health practitioners play an important role in educating and informing the public about the benefits and safety of vaccines. There are several underlying reasons for vaccine refusal. These include cultural beliefs, fear of side effects, misinformation that are often spread through social media and other media outbreaks. According to the National Institute of Health, media plays a role in keeping vaccine scares alive, even in the face of strong scientific evidence showing how vaccines are safe and effective. When vaccination rates decline, the outbreaks become more likely. We have seen this with diseases such as COVID-19 and measles, which can spread rapidly in communities with low vaccination coverage. This highlights why advertising and advising vaccine hesitation is a crucial aspect in the public health priority today. To overcome vaccine hesitancy, public health efforts must focus on trust, education, and access. One effective strategy is working with religious leaders and trusted community figures. These individuals can spread accurate vaccine information in a culturally sensitive way, which can increase trust within communities. Education is also essential. Public health practitioners and healthcare workers need to clearly explain the benefits, safety, and effectiveness of vaccines and provide understandable evidence-based information and helps people feel more confident in their decision to get vaccines. Improving access to vaccines is another key strategy. Offering easy and accessible mobile vaccination clinics helps reduce barriers such as transportation, time, and disability access. According to guidance from the Michigan government, ensuring equity means designing clinics that are accessible to everyone, including individuals with disabilities. Policies measures can also support higher vaccination rates. Vaccine mandates for school entries and certain workplaces have been shown to increase coverage and protect the public health. Finally, healthcare workers play a crucial role by discussing the importance of vaccines directly with patients while remaining respectful and sensitive to the personal beliefs. This patient-centered approach helps build trust and encourage informed decision-making. As public health practitioners, there are several key skills needed to be effective in improving community health. First, practitioners must collect and analyze data. This is essential for making informed decisions and responding to outbreaks effectively. For example, tracking disease patterns allows us to identify risk early and intervene promptly. Second, we must be able to communicate with health information to a variety of audience. This includes the general public, media, and policymakers. Being able to translate complex health data into clear, actionable messages ensures people understand the risk and take appropriate action. Third is understanding social determinants of health is critical. Practitioners need to recognize how factors like income, education, and environment affect health and work effectively with diverse populations to address these disparities. Fourth is the ability to handle emergency health threats, such as the pandemic or antimicrobial resistance, is vital. Practitioners must respond quickly, coordinate with multiple agencies, and implement interventions that protect the population. Finally, being ethical and evidence-based underpins all public health work. Practitioners must make decisions grounded in science while carefully considering ethical and ensure fairness, equity, and trust in the community. So, effective public health practice combines strong analytic, communication, social, and emergency responses that are and include ethical skills. Train analytic teams in epidemiology and health communication. They highlight the importance of having specialists who can analyze health data and trends. They explain that these teams help identify outbreaks early and communicate risk effectively to the public and policymakers. Next is the capacity to respond to arising threats. They emphasize the preparedness for infectious diseases, outbreaks, and other health emergencies. They mention the need for rapid detection, coordination, and action to minimize health impacts. Next is improving research and innovation. This explains that ongoing research and innovation approaches lead to a better strategy for preventing and managing diseases. Next is community and school involvement. Stress the value of engaging with communities and schools to promote preventative health measures, and mention programs like health education campaigns, vaccination drives, or hygiene that innovates and builds healthier populations. Lastly is setting supportive policies. Highlight the role of policies in shaping effective public health interventions and ensuring emergency preparedness. For example, like vaccination mandates, disaster response plans, or funding the public health infrastructure. Preventative measures in global disease control emphasize that controlling diseases before they spread is crucial. They highlight the role of advanced research in vaccines in stopping outbreaks early. Next is advance in mRNA and genomic technology. This explains that mRNA vaccines are safer and can be developed faster than traditional vaccines. Genomic technologies allows us to understand pathogens better and making vaccines more effective. Next is artificial intelligence for outbreak prediction. AI can help predict where and when outbreaks might occur. This allows researchers to develop vaccines more effectively and safer. Next is constructing vaccines quicker but also in a safe manner. Being able to produce vaccines faster during an outbreak can save millions of lives. The COVID-19 pandemic is a prime example of why rapid vaccine developmental is critical. With these advancements in preventative measures, mRNA and genomic research, and AI-driven predictions, in about the next 20 to 25 years, we can see progress in preventing diseases and promoting overall global health. This last slide includes my references. Not only did I include the textbook, but I also included other vital sources that I got my information from. This includes the end of my presentation. Thank you.